Good afternoon. My name is Leanne, and with me today I have 4 final year students from Kingston University. I shall give them a chance to introduce themselves, starting with.
I'm Daniela, I'm part of the Snooze the Booze campaign for alcohol awareness.
I'm Khadija, I'm part of Kingston Healthy Hearts.
I'm Sarah, and I'm also part of the Kingston Healthy Hearts.
And I'm Victoria, and I'm part of the Snooze the Booze alcohol awareness campaign.
Okay, so I hear Snooze the Booze and Healthy Hearts. What's the connection there?
So we've noted that there's a link between the two campaigns,
Mm-hmm.
and I feel that this topic isn't really touched upon a lot. So and we just feel it's good to look further into the links that we can discuss.
All right. So hypertension. So we all hear that it's a silent killer. I don't know, can you at least explain to me, Khadija, why we say hypertension is a silent killer?
Hypertension is referred to as a silent killer since it shows no obvious signs or symptoms. Many people are unaware that they have hypertension. It can progress to an advanced stage before it gets discovered, for example, heart attack or stroke. There are many causes of hypertension, for example, kidney disease and diabetes. Hypertension can also be caused as a result of taking certain medications such as steroids and antidepressants. The best way of knowing if there's a problem is to get your blood pressure checked, and you can do this in your local pharmacy.
So, Victoria, you are part of the alcohol awareness campaign. So, would you say then that there is a relationship between alcohol and hypertension? And
Oh
if
yes,
there is,
definitely.
clarify,
Definitely. Effects of alcohol on the body are complicated. So it not only affects your blood vessels, your heart, but it can also affect your liver, your brain, and your kidneys as well. So in terms of how alcohol links to increased risk of hypertension, there's a buildup of fluid in cells and tissues, which leads to the blood vessels becoming narrow, so there's reduced blood flow, and that sort of leads to that raised blood pressure. And obviously you have the effects on the kidneys, so reduced urine output, have the effects of the liver, which leads to scarring and obviously irreversible damages, and obviously lack of signals within the brain, which sort of prevents you from doing certain activities.
so there's irreversible damages on the blood vessels themselves.
So it's mainly associated with blood vessels, but also it has an effect on other parts of the body, which is also like a whole system.
So, Sarid, we have heard about the role that alcohol plays in hypertension. Now, I want you to tell me, should we then consider alcohol a major cause of hypertension, or is it just a risk factor? Are there any other factors that are more likely to be the cause of hypertension?
Okay, so it's a good question. In terms of alcohol, it's a major risk factor that can link to hypertension. There are also other risk factors, such as being the age of over 65. Also your diet, such as having salt, being a smoker plays a big part as well. And risk factors as well, so such as smoking, and also if someone in the family has got hypertension, that can also link. And also if you are from a Black Afro-Caribbean descent. With that being said, there are also a few other risk factors, but these are primarily the main type of risk factors that are associated with developing hypertension.
So alcohol is not a major, or is it?
I wouldn't say it's not a major risk factor. However, it is a significant one, but not a big one.
So if you have a contribution of more than one risk factor, that will probably exacerbate hypertension even more.
So Khadija, you mentioned that hypertension is a silent killer because not many people sort of know if they have it until they already have it.
Yeah.
So how can someone know that they have hypertension? Elaborate.
High blood pressure does not usually have any symptoms, so the best way to find out is to get your blood pressure checked. However, some of the symptoms of severe hypertension include shortness of breath, headaches, and nosebleeds, but these symptoms are not specific.
But what are the numbers? What numbers are we dealing with? How do we, what are we measuring? What are we looking at?
So before we go into the numbers, let's first talk about how the blood pressure is actually measured. So you use a blood pressure device, and the units are millimeters per mercury. And the numbers Ideal numbers would be 120 over 80, and the 120 is the systolic, so that's essentially your heart pumping blood, and the 80 is the diastolic, so when your heart's relaxing. Anything really beyond 140 over 90 is classed as hypertension, and yeah.
So if you are like 130 over 85, are you okay?
Yeah, so obviously if you get 130 to 90, it is fine, it is normal at the end of the day, but it was good to repeat results. If it is recurring 130 over 90, it can lead to hypertension, but that wouldn't be classed as hypertension as of yet.
Victoria, how can people actively reduce how much they're drinking?
It's a good question to consider. So first of all, we want to have the correct mindset. So if, say for example, if someone's not ready, then don't push. Like it depends on the person and how they feel. If they feel like, yes, I'm ready to stop drinking or reduce my drinking, that's when that happens. It's also good to get support from friends and family, because you're not going through it alone. You can have sort of like words of encouragement and support from your loved ones and friends, so you're not going through it alone. In terms of the drinking itself, it's good to have drink-free days. So that's when you're not drinking at all, to prevent that overconsumption. And it's also good to have 0% alcohol alternatives. So these are the drinks that contain no alcohol, or to have mocktails. So mocktails is alcohol-free alcoholic drinks. So they look like alcoholic drinks, but they have no alcohol in it. So that's sort of good alternatives. Yeah, especially if you're in an environment that you're more likely to drink. For example, in a pub or a restaurant or nightclub, that kind of thing.
Right. Daniela, anything to add on to that?
Make sure you eat before you drink. You don't want to have something. Drink lots of water and juices, a healthy alternative, and address the cause of drinking. Why are you actually drinking? Is it to avoid something?
Right.
Maybe you can talk to your pharmacist or your GP, therapist. There's many options.
So someone like me who doesn't drink often, Daniela, I usually go to parties and then maybe I can have 6 or 7 pints depending on my mood, but naturally I'm not an alcoholic. Would I then need to go to a therapist as well, or there are certain conditions?
You don't need to go to a therapist, but if you are seeing that alcohol is affecting your social life, your family life, your work life, it's getting in the way of things, maybe you should identify the cause.
Alright, so then a therapist would be recommended in that case.
Or you can also speak to your pharmacist or GP,
Or
to
GP.
get that advice on how to sort of reduce that alcohol consumption. And there's also ways that the GP can signpost you to, or the pharmacist can signpost you to various institutions or organisations that you can get help and seek help from.
Sorry, so let's say you decided to lower your alcohol intake
Yeah.
to at least try and save your heart or your cardiovascular system, let's say. Is there anything else that one can do to consolidate that?
Yeah, so quitting smoking is essential in dropping down your blood pressure, and exercise is vital as well. About 150 minutes a week you should really aim for, and also eating a healthy, rich diet, such as vegetables, and a Mediterranean diet is also beneficial to reduce your blood pressure. So yeah, there are other factors you can consider other than alcohol.
All right, that is it from us and the guys. For more information, just try to go to we have these groups on social media, Healthy Heart and Snooze the Booze. You can go there and ask any questions if you're interested. They'll be able to help you with more. From us, it's goodbye.
Bye.